Hi guys, good morning everyone, and now we'll start the class. Okay, so hi Maria, you had some question, right? What was that?
Hi, doctor. Yes, I want to know the difference between Hydatidiform mole and choriocarcinoma.
Okay, in Hydatidiform mole, and to understand Hydatidiform and choriocarcinoma, we should know what is a normal histology of the placenta. So the placenta has villi. This is the villi of the placenta. This is how it looks. And the inner lining of the placenta, this is normal. Okay, normally the inner lining of the placenta has the cytoplasm, which is also Maria, which is also called the stem cells of the placenta. Okay, and in the outer lining we have the nest of cells. The outer lining of the villi have the nest of cells that is called the syncytiotropoblast. And it produces, any idea, Sri? What does it produce, syncytiotropoblast? We learned in the previous
HCG?
class.
HCG.
Yes, very good. It produces HCG. Okay. And normally this villi is vascular. This villi is vascular. So a normal placental histology is it does have villi. It has an inner layer of cytotrophoblast and outer layer of, you can call it as a syncytotrophoblast Jan cells, which produces, like you guys said, HCG. And it is vascular. However, like you said that, what is hydatidiform mole? Hydatidiform mole is a pathologic condition where there is a proliferation of cytotrophoblast and syncytotrophoblast. Let's understand that. Now, hydatidiform mole is a condition where there is proliferation of cytotrophoblast and syncytotrophoblast. And this villi in hydatidiform mole will be avascular. There will be no vessels, and there will be dilatation of this villi. That is why it is called hydropic villi. It's called hydropic and avascular villi. And you see proliferation of the cytotrophoblast and syncytotrophoblast. Now, Maria, if I ask you this question, can you tell me when there's a proliferation of syncytotrophoblast, what will happen to the HCG level? When there's a proliferation of syncytotrophoblast, what will happen to the HCG level?
Will increase.
Very good. It will increase, super increase. Why? Because like you guys said that normally syncytotrophoblast produces HCG. But when there's a proliferation of syncytotrophoblast, as you see in hydatidiform mole, the beta HCG level will be, very
High.
Correct? And how the patient will manifest, that the patient, like how she will complain? She will complaining of or vaginal
Bleeding.
and grape-like vesicles. And we confirm with the ultrasonography where these vesicles, this dilated villi, this proliferation of this hydropic villi, you see there was a hydropic villi, so that will look like a snowstorm, appearance on ultrasonography. Okay, so they have this partial mole, and they have the complete mole. How will you know it's partial or complete mole? In partial mole, you see the fetal parts, and in complete mole, you do not see the fetal parts. Clear? Shri, seeing all of you got it, guys? Did
Yes.
everyone get it?
Yes.
Perfect.
Now, what is choriocarcinoma, like you asked, what is choriocarcinoma? This is Hydatidiform mole. So Hydatidiform mole may turn into, the Hydatidiform mole can turn into choriocarcinoma. Now, by definition, like Sri, you were answering in the previous class, by definition, carcinoma, they metastasize to the lymph nodes. Sarcoma, they metastasize to the hematogenous root. Okay? But choriocarcinoma is accessory to the rule, isn't it, guys? So choriocarcinoma, though it is carcinoma, it does not metastasize to
Lymph nodes, yes.
Choriocarcinoma metastasize to the
Hematogeneously, it's one of the four.
Did you get it straight?
Yes, doctor.
Okay. So that choriocarcinoma metastasizes to the hematogenous root. Microscopically, choriocarcinoma, okay, microscopically, you see absence of villi. Very, very important. Like you saw villi in Hydatidiform mole, you do not see villi in choriocarcinoma. Super, super high yield point, and there will be proliferation of cyto and sensitive. So, Sri, can you tell me that what you see in the chest X-ray in a patient with choriocarcinoma?
Snowstorm appearance.
Chest X-ray.
Cannonball metastasis.
Very good. They have cannon. Snowstorm is ultrasonography of finding of H mole, correct? Like
Yes,
we saw,
yes.
the snowstorm is for the H mole. But in
Yeah.
choriocarcinoma, because it's a carcinoma, it metastasizes to the hematogenous root and it goes to the lung. And in the lungs, they will have cannonball-like appearance. And this is cannonball metastasis in the choriocarcinoma, metastasizing to the lungs. Okay? Very clear, guys? Choriocarcinoma and H mole?
Yes, doctor.
Clear? Okay. All right.
Thank you.
Now, do you have any other question, guys? Yes? Sri, any other question?
Yeah, can you please explain about adenomyosis and endometriosis?
Adenomyosis and endometriosis. Okay. As the name suggests, adenomyosis and endometriosis. Before we understand this pathology, let's understand the normal histology of the uterus. Metriosis. Okay. So the uterus has this, the outer layer of the uterus is the serosa. The middle one is the myometrium. The smooth muscle is the myometrium. Okay. And this is the smooth muscle and the endometrium. The endometrium, and that is lined by the columnar epithelium. Okay. And this is columnar. Then we have this is the cervix, with the level of the cervix. They have the ectocervix. Any idea, guys, what the lining of the epithelium of the ectocervix and endocervix?
Ectocervix is squamous epithelium. Endocervix is columnar epithelium.
Very good. Okay. Endo is columnar and ectocervix is squamous epithelium. And vagina is also lined by the
Squamous epithelium.
very good. Very good. Okay. Now, so this one. Shri, you asked me this, that what is adenomyosis? Adenome is glands. So endometrium, when you look at the microscope or microscopic appearance of the endometrium, what you see is the endometrial glands. And those glands are called the adenome. Those are the adenome. Adenome is glands that are acinar pattern. So adenomyosis, that means endometrial glands when you see in the myometrium. Sri, endometrial gland when you see in the myometrium, we call it as
Adenomyosis.
Adenomyosis. And how the patient will present with? They will present with bleeding and endometrial glands in the myometrium, and the uterus will be bogey uterus
Baggy uterus.
and globular. Very good. Bogey and globular. All right. So bogey uterus and globular uterus. And endometrial glands in the myometrium is called adenomyosis. What is endometriosis? When the endometrial glands will leave the endometrial cavity and stay endometriosis. Endometriosis. That means the endometrial glands will leave the endometrium and stay, like they come and stay in the ovary. Then we call it as endometriosis, or it can be in the broad ligament. We call it as endometriosis. It sometimes, you will see in the caesarean section scar. That is called scar endometriosis. Okay? So the endometrial glands are leaving the house and staying in the ovary, in the broad ligament, in the caesarean section scar. When the endometrial glands are in the ovary, they can bleed there, and that is now called. Any idea, guys? What is it? What it is?
Chocolate cyst.
Very good. It is called the chocolate cyst. Okay. I hope Singh and Nihal, everyone is getting. Give me yes in the chat box, guys. If everyone got it, give me yes in the chat box. Perfect. Okay. How about Sri? All right.
Yes, got it. Thank you.
Okay, so this is the difference between. Now, how does the patient with endometriosis present? They present with all the D's. All the D's. Okay, 4D you should know. They have dysmenorrhea, dyspareunia, okay, and dysphagia. Dysmenorrhea, pain during menstrual cycle. Dyspareunia, pain during sexual intercourse. Dysphagia, pain during defecation. And the treatment?
Danazol.
Very good. Very good. Give danazol. Right? And it is one of the most common cause of infertility. All right? Remember. Okay? Very clear. All right? Any other doubt, guys?
No, madam.
No doubt. Very clear. Okay? So, Maria, do you have any other doubt?
No, doctor. It's perfectly clear. Thank you.
Thank you very much, guys. And tomorrow we'll continue the same time. Okay? See you tomorrow. Take care, everyone.
Thank you.
Thank you.